Falls are a serious health concern for older adults. Each year, more than 30% of people over 65 fall. Most falls occur at home, performing everyday activities such as walking, climbing stairs, or getting in and out of bed. Falls are the leading cause of death from injury for older adults. More than 90% of older adult hip fractures are caused by falls. Physical injury is not the only result of a fall. The emotional effect can be devastating. Fear of falling again causes some people to restrict activities, even if there was no physical injury. They stop doing the things they once enjoyed, such as regular exercise, going to church, or visiting with friends. With these lifestyle changes, feelings of loss and helplessness may arise, affecting confidence and self-esteem. Inactivity can cause depression, stiff joints, and a decrease of muscle strength and coordination. Avoiding activities because of fear and anxiety can actually increase the risk of falling again. The normal changes that occur with aging place the elderly at a greater risk for falls. The cardiovascular system, muscles, nerves, eyes and ears all play an important role in keeping our balance, and these systems tend to decline as we age. The elderly are not the only people prone to falls. People with chronic disabilities that result in pain, weakness, stiff joints, dizziness, or difficulty walking are at risk for falls. Some of these conditions are arthritis, cardiovascular disease, dementia, stroke, Parkinson's disease, osteoporosis, and seizures. Medical conditions that contribute to falls should be treated by a doctor. Alcohol impairs balance, and alcohol abuse increases the risk for falls. People we care for are not the only ones who fall. Caregivers who provide care in the home fall too. Take time to position your body correctly. Use proper body mechanics when helping someone to move. Never rush to do your tasks or rush the person you're caring for. The elderly are at a greater risk for falls when rushed, stressed, physically ill, or upset. Never carry objects that are too heavy or large. This could result in a loss of balance. Don't block your vision carrying bulky packages. Make more trips with smaller loads. Shoes play a big role in fall prevention. Shoes should have a non-skid low heel and a good tread. Avoid smooth leather shoes which are slippery or tennis shoes with a smooth bottom. Shoes with laces or Velcro should be firmly fastened. When walking on ice or snow, wear shoe chains or studded traction soles that help keep you from slipping. In cases where ice cannot be removed completely, use sand, cat litter, or a commercial ice melt to provide traction and reduce the chance of slipping.
In our fall risk program, one of the first things we do is we interview the patient and talk with them about problem areas that they may have identified that we can give them solutions to help them reduce the risk of falling. And them is nighttime, getting up at night, maybe going to the bathroom. And when you do, tell me what happens at night.
Well, I don't wear my glasses and I feel a little unsteady.
Okay. Do you turn lights on in the evening when you get up?
No.
Okay. It's very important to realize that as you get older and you're not using your body so much for balance, you get very dependent on your vision. So nighttime, people getting up, they're a little disoriented, really need to have lights on in the room they're in and the room they're going to. And keeping your glasses nearby is a really good idea. The other strong thing that I feel about fall risk is our changing perception about the elderly. And we used to believe that loss of balance as you got older was an accepted part of growing old. And that's really something that we're trying to change, people's understanding of aging. It does not have to be your natural course of aging. So keeping active is very, very important.
I think that people think that balance is one thing. It's one like organ in their body that's going haywire that they just need to fix. And what I attempt to do is to teach them that balance is contributed to by many parts of their body working together in a coordinated way. I think the other thing that happens is that people think that balance is the ability to just stay still and not wobble. And instead what I try and teach them is that it's the idea that you need to be able to catch yourself when you lose your balance rather than the ability to stay still in the first place. Part of what we do for practice is to look at the things that people don't do well. And one of the things is that people don't really use their trunk muscles as well as they once did. When you're children, you tend to use these muscles walking on lines, crawling on fences, but as you age, there's not really the need to move that quickly. Once you can't feel the ground as well as you once did, it's more important to have trunk muscles to be able to help you. And we try and emphasize that in patients that we work with.
At least 1/3 of all falls in the elderly are a result of hazards in and around the home. Tripping and sliding over rugs and runners is a leading cause of falls in the home. By making some simple adjustments, falls due to hazards can be prevented. Removing runners or rugs is the best solution. Another option is to use a rubber matting under the rug, or apply double-stick tape adhesive to the back of the rug. The adhesive also prevents rugs from curling, which can cause someone to trip. You can buy rugs with rubberized backing that helps prevent slipping. Electric cords that run along pathways may cause someone to trip. Place electric cords along the wall. Do not place cords or wires under rugs or runners. Uneven surfaces can cause tripping or catching on the carpet. Keep walkways in the middle of rooms free from fans and heaters. Avoid clutter on floors. Magazines can be very slippery. Toys for children or pets can be hazardous. Telephones should be easily accessible. Rushing to answer the phone can increase the possibility of falls. Have several phones located throughout the house, or consider a portable phone that can be moved from room to room. Low objects that blend into the carpet, such as glass-topped coffee tables, baskets, and low stools, can often become a tripping hazard. Chairs should have a back support and armrests. Armrests give support when getting in and out of a chair. Be sure to mop up spills immediately after they occur. Place a non-skid mat in front of the sink area to soak up water. Place items that are used regularly in a convenient place. A good rule of thumb is to place those items between the hip and eye level. A reacher can eliminate unnecessary bending or reaching. Reachers are available at home medical supply stores. The bed should be a comfortable height and firm enough to get in and out of easily. The bed needs to be stable and not slide when getting in or out. Moving the bed against the wall can help to stabilize it. Beds with wheels should have wheel brakes that lock the bed in place. A telephone and lamp should be at the bedside table to eliminate the need to get out of bed to answer the phone or turn on the light. A flashlight nearby works for emergency situations. Eyeglasses, canes, and walkers should be left near the bed. Keep electric blanket and heating pad cords out of the way so they don't become a tripping hazard. Avoid dresses, pants, and robes that are too long and loose. They can cause someone to trip. For people who are unstable on their feet, have them sit rather than stand when dressing. High or low blood pressure can cause dizziness, especially when getting up from a bed or chair. People who experience dizziness upon rising should be encouraged to sit at the edge of the bed or chair for a few minutes before moving into a standing position. Bathrooms are a common area for falls. The bathroom can be slippery because of the potential for water on the floor. Textured strips and appliques work well in tubs and showers. Rubber slip-resistant mats work both in and outside of the shower or tub and help prevent slipping. To reduce slipping when getting in and out of the tub, avoid adding oil to the bathtub water. The best bathroom supports are slip-resistant grab bars. They should be placed inside and outside the shower and tub area and next to the toilet. Use a shower chair or bench for someone who is unsteady on his or her feet. This will allow the person to sit while showering. A handheld shower head will make it easier to shower when sitting. The chair or bench should have a back support and rubber-tipped feet to keep it from sliding. Someone who is weak or has balance problems may have difficulty getting on or off the toilet. A raised toilet seat will make it easier and safer. Some come with armrests. Proper lighting is more of a necessity for older adults who need more light to see than someone younger. Cataracts and glaucoma are two common conditions that limit vision and could increase the risk for falling. Avoid using low-wattage light bulbs. This makes seeing at night even more difficult. Always use the maximum wattage suggested by the manufacturer of the light fixture. Auto touch lights turn on the light when you touch the base and are helpful for people with arthritis or painful joints. There are adapters that will turn your existing lamp into a touch-sensitive lamp. The light goes on when you touch any metal part of the lamp or the cord. Stairs are the most common place for falls that result in serious injury. Stairs need to be lit so that each step is clearly seen when going up or down, especially the first and last step, which is where most falls occur. Stairs that are carpeted should be checked regularly to be sure the carpet is securely fastened. Do not place loose rugs or runners on the top or bottom of stair landings. Most falls that occur outside are on curbs or steps. Step edges should be marked with reflective tape that is designed for outdoor use. There is also traction tape that can be applied to the stair treads. This will minimize the chance of falls when stairs are wet. Always follow the manufacturer's instructions when applying any stair tape. Uneven door thresholds can cause a fall. Use a contrasting colored adhesive strip along the edge to make them more visible. Be sure pathways and stairs are clean. Leaves, moss, snow, and ice can cause serious falls. Side effects from medications, such as drowsiness, dizziness, and weakness, can contribute to falls. Medications that may increase the risk for falls include diuretics, high blood pressure medicine, sedatives, and pain relievers. When walking with a walker, hands must be free to grasp the handles on both sides. Packages or small items should never be carried by hand, but placed in a basket or saddlebag attached to the walker. Avoid carrying heavy objects, which could cause an imbalance.
Gait belt is a belt that is utilized around the waist of an individual that needs help with transfers from one surface to another or when walking. It is for the assistant to hold on to. That's the key part. Oftentimes if you're helping someone walk or transfer from one surface to another, there's nothing to grab onto other than an arm or the pants or something like that, and that's not very safe. This is the proper way to apply a gait belt. Generally, we're going to shoot for the same area of just above the hips and below the rib cage.